He got home from work. We shoveled the walk, went out, and it had snowed that morning, went out and shoveled the walk, and came in to sit down, play some Nintendo, and I went out in the kitchen to make tea and come back, and he was out.
I think I was out shoveling snow right before my heart attack, and I came in to sit down and sat down, was playing a game of Nintendo. That's when the lights went out.
So I got on the phone and called 911, and she helped me get through with the CPR. She told me to get him on the floor and what to do, how many times to push and then to breathe, while the paramedics were on their way. And they were there, and it seemed like no time. They just took over.
We never actually stabilized Mr. Shirley, okay? We never got a pulse back. He never started breathing on his own. We had to intubate him to oxygenate him. Then we performed chest compression, CPR all the way into the hospital while pushing ACLS drugs and giving him shocks after a series of drugs, for which he was pretty much unresponsive.
Oh, a lot of patients come in a condition like that where the paramedics have been working on them for at least half an hour, 45 minutes, maybe sometimes even longer. And by and large, most of those patients don't leave the ER. They die.
We have the chest pain center here at the hospital, so we're all aware of cardiac damage and how quick we can get it turned around before there is cardiac damage. When they come in presenting with chest pain, and this is an extension of it. If we have the cath lab in the emergency department, the patients can get to the table quicker to get the vessels open to decrease the amount of damage or have no damage to their heart.
He was not a living human being at the time we got our hands on him. They can't admit a dead person to CCU or to ICU. And at the point that we started working with him, he was dead. He had no spontaneous heart rhythm. He wasn't breathing on his own. It was all the support of the CPR and having the breathing tube down his throat. So if they can't, in the emergency room, if they can't stabilize him enough and resume a heart rhythm and get at least a little bit of a blood pressure, he can't be admitted to a floor. Having our emergency room cath lab right there, he wasn't admitted. We took him and we did what we could to try to bring him back to life and get him admitted into the hospital so he could recuperate.
It happens that we have the cath lab in the emergency room, and it happens that I thought, well, I did already a patient before, and this was the second, so we thought we can give a little extra. And then we got the heart back, beating. But there was a lot of work to be done.
Once we got him on bypass, the machine did all the work. It was giving him the oxygen and circulating the blood throughout his body and stabilizing him, so Dr. Sabe could do his part and open the arteries and try to restore the blood flow.
Dr. Sabe was here, and we took the patient over there, and he put the patient on peripheral bypass so he could work on the heart. And he was able to open Mr. Shirley's vessel, and Mr. Shirley survived.
I just think they got me, got the operation done, what they had to do to get my blood flowing again, and got my heart pumping again. That was the main thing.
There is no space for mistakes. Everything has to be done right. It's so critical. So you can't do this alone because there is few steps. So the team, and I was never going to start this without securing a well-qualified team. And it took us years to build this kind of assistance in all aspects.
I'm a very faithful person, and I got to see God's activities taking place. I'm glad I work at a faith-based organization, but I know God was here with us that night. So it was wonderful to see that. I know God was with Mr. Shirley.
He regained all of those abilities. I think he became able to communicate, to play video games, to interact with his family, to make financial decisions, to make good judgments about what he was going to do in the future. And his regaining those really is a compliment to his wife's involvement and his motivation. I think he's done phenomenally.
Well, I think this is great. I think it's cutting edge. You think about all the, I've been here for almost 10 years, or over 10 years now, and very few people that I've resuscitated, that came in full cardiac arrest, walk out. If they do get out of the emergency department, very few of them actually leave the hospital. To see somebody come in that condition, to leave walking, at least coming a few months later where he's awake, talking to me, I think that's just incredible. It's incredible.
Mercy is an exceptional hospital because a majority believe in the mission. And the people, as you heard from others, that they really committed to help the human being when they are sick. As far as the technical part involved here, everything started by somebody tried a new approach to things. And our motivation was, can we do further to those people who are sick as a consequences of the heart attack? And initially I thought it was getting too far, but thanks God it's not.
I was here every day and started to realize that this was one of a kind thing, that if he had went to another hospital, he probably wouldn't be here today. He wouldn't be here today. I'm sure of that. And now he drives a car, He reads, we bought a house, we had to remodel the whole house. We've done that. Painting, carpet. He used to lay carpet also, and he laid linoleum in our house, which I never would have believed would have ever happened. No, never.
It turned out better. It turned out much better than I expected. Just better.
I'd say they did a wonderful job of getting me back and got my blood flowing again. My strength is coming back. I feel 100%. They did a wonderful job.